Hey, it's Dr. Winters here, and I want to share with you something that I see all the time, and that's people who feel terrible, but their lab work is normal, their heart testing is normal, their scans are normal, and they don't know what to do because they feel horrible. Well, a lot of times this involves your autonomic nervous system, that part of your nervous system that controls your blood vessels, organs, and glands. And it makes all those things happening from your heart beating to your lungs breathing to digesting your food without you thinking about it. That's why it's called autonomic. And we have our sympathetic portion, our fight-flight portion, and then we have our parasympathetic portion, our rest, digest, and repair portion. And a lot of times that part isn't working right. And the main part of the parasympathetic nervous system is something called the vagus nerve. And I know you've heard a lot about that lately, but you're not really sure about it. Well, it's a nerve that comes off the base of your brain, comes down the front of your neck and into your heart and into your gut. And that nerve is getting more and more attention, but doctors don't really look at that nerve. So if you're having heart tests, they're going to look for structural or electrical problems with the heart. They're going to look for blockages, they're going to look for valve issues, or they're going to look for electrical conduction problems within the heart itself, but they're not looking at the nerve signaling externally that goes to the heart and that influences the heart. So they're not looking at that. And the same way, if you get digestive testing done, you can get scans and you can get scopes and you can get breath tests and things like that. Well, they're looking for infections, they're looking for inflammation, they're looking for damage, but they're not looking for the nerve that goes to your digestive system. In fact, we had a person recently had surgery for gastroparesis, which is the stomach not contracting properly, not moving food through right. And they'd never even heard the name vagus nerve. And that's the nerve that primarily controls the stomach. So docs in the medical model aren't testing for this. They're not looking for it. We do look for it. We use a test called heart rate variability. Heart rate variability tells us about your autonomic nervous system. If you're too stuck in fight or flight, gas pedal on. If you're too stuck in parasympathetic, brakes on, or the brain is having to work too hard because those systems can't work properly themselves. So we see all that from heart rate variability. And when this vagus nerve is off, lots of things go crazy because we get stuck in fight or flight, then our digestion shuts down and we aren't absorbing nutrients properly. Our detox pathways slow. Our immune system can get confused. Our hormones don't get the right signal to make the hormones. And you can't fix this in isolation. You have to really work with the nervous system and work with it all together to get this nervous system working right. And then we can work with systems that have been compromised as well. But it's not, it involves regular input to your nervous system to balance. And that's one of the reasons we work on something called the safety corridor, which is work on the front of the body, all down through the gut. I know you can't see my hands there on the video, but all down through the gut, through the diaphragm, around the heart, through the ribs. All those make a huge difference in how this vagus nerve is signaling back and forth with the brain and back. And in fact, there's a reflex called the inflammatory reflex, which is mediated by the vagus nerve. It senses inflammation on the sensory, sends signal back to the brain. The brain sends a signal back down the vagus nerve literally to the immune cells in our body and our spleen to control inflammation. That's called the inflammatory reflex. And so as we work on the nervous system, especially in the front of the body to calm the body, but also the occiput, because that can affect where the vagus nerve comes down in front of the top vertebra of our neck, those areas are key to the vagus nerve working properly. As we work with those areas, your system can get calmer and calmer and more balanced, and it can regulate itself, because sometimes we need fight or flight. We get a big stress, we're going to need to be in fight or flight temporarily, but then we need to be able to come back out of it. And a lot of us can't come back out of it. We stay there way too long. And then we can't sleep right, we can't digest, our nervous system doesn't work right, and we have high histamine. Because so many of our patients today have high histamine, and they see it on their skin, they see all the redness, the patching, the hives type of issues, the allergic reactions. all from high histamine. But remember, histamine is released when the nervous system feels like it's in danger. We have to release chemistry to try to neutralize that danger. And so our systems are releasing too much histamine, and we have all these high histamine symptoms. Whereas when we get the nervous system calmed down, it doesn't have to feel like it releases those danger signals as often or not as severe. And that can make a huge difference for our people with high histamine. So whether you're having heart issues, digestion issues, or histamine issues, there's a good chance by helping your nervous system get calmed down that we can help you out. Give our office a call, 270-554-2141, or text us at that number as well, 270-554-2141. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.